short video, we are going to talk all about health systems and level of care. So let's jump in. Let's first talk about the definition and importance here. Integrated primary and mental health care is a holistic approach within health systems that combines physical and mental health services to provide comprehensive patient centered care. By merging these two areas, healthcare clinicians can address both the physical and psychological aspects of a patient's health, which promotes better overall outcomes. This model enhances the coordination between primary care physicians and mental health professionals, allowing for seamless communication and continuity of care. And ultimately, it reduces the stigma associated with seeking mental health services and improves access for patients who might otherwise face barriers to mental health care. Integrated care is effective in managing chronic conditions, reducing healthcare costs, and increasing patient satisfaction by treating the whole person rather than just fragmented aspects of their health. It also increases access to services, which improves early recognition and intervention for psychiatric and medical concerns. And we have some models of integration. The collaborative care model and co located services are two approaches to integrating primary and mental health care, each with distinct methods of enhancing patient outcomes. The collaborative care model emphasizes a systemic, team based approach where primary care providers, mental health specialists, and care managers collaborate closely, often utilizing shared care plans and continuous communication to again manage a patient's overall health. This model relies heavily on leveraging technology and structured protocols to facilitate real time collaboration and proactive treatment adjustments. In contrast, co located services involve situating primary care and mental health services in the same physical location, promoting ease of access and immediate referrals. And while this proximity allows for greater convenience and the potential for informal provider consultations, it may not necessarily ensure the integrated treatment planning and coordinated follow up seen in the collaborative care model. Both approaches aim to improve patient care by breaking down barriers between physical and mental health services. But the collaborative model is more comprehensive in fostering active and ongoing interprofessional relationships. So we have different levels of care here. First, let's talk about the outpatient. In outpatient settings, psychiatric mental health nurse practitioners, like you will be someday very soon, provide care to patients who do not require hospitalization. They offer services such as individual and group therapy, psychiatric evaluations, and medication management. These environments foster ongoing relationships with patients, allowing for continuous monitoring and tailored treatment plans that support long term mental health management. Outpatient care emphasizes flexibility and convenience, making it accessible for patients to receive the necessary support while maintaining their daily routines. Next up, in inpatient settings, PMHNPs deliver intensive care within hospitals or psychiatric facilities to patients experiencing acute mental health crises. These practitioners focus on immediate stabilization, thorough assessments, and initiating treatment plans in a structured and secure environment. Inpatient care is crucial for patients who are at a high risk of self harm, harm to others, or are unable to care for themselves safely as a result of their mental illness. These settings provide 24-hour supervision and comprehensive therapeutic interventions. PMHNPs in these settings work collaboratively with a multidisciplinary team to develop and implement effective treatment strategies. Next up, we have residential. Residential treatment settings offer a supportive, long term care environment where PMHNPs assist individuals with chronic mental health conditions or substance use disorders. In these settings, PMHNPs provide comprehensive therapy, medication management, and life skills training, all aimed at rehabilitation and the promotion of sustainable recovery. The structured nature of residential treatment allows PMHNPs to foster a therapeutic community where patients can develop healthy routines and coping mechanisms, all of which help contribute to long term well being. All right, deep breath with me. Next up, we have community assessment teams. And within community assessment teams, PMHMPs conduct mobile crisis interventions, mental health assessments, and can connect individuals to appropriate care services. So these teams play a vital role in providing immediate support and preventing unnecessary hospitalizations by assessing needs in real time and offering crisis stabilization. So, PMHNPs in these teams engage with patients in various community settings, ensuring that those in need receive timely and accessible mental health interventions and referrals. And of course, we have school mental health. In school mental health settings, PMHNPs address the psychological and emotional needs of students within the educational environment. They provide counseling, psychoeducation, and early intervention services which help identify and manage mental health issues before they escalate. By working closely with educators, school psychologists, and families, PMHNPs support a holistic approach to student well being, promoting a healthy, safe, and conducive learning atmosphere. Now, a big one we're seeing nowadays is rural mental health. In rural mental health settings, PMHNPs address the unique challenges faced by underserved populations, often utilizing telemedicine and mobile health services to help bridge gaps in care access. They provide comprehensive mental health assessments, therapy, and medication management, often adapting their practices to meet the specific cultural and logistical needs of rural communities. By addressing barriers such as provider shortages and geographic isolation, PMHNPs play a crucial role in improving mental health outcomes in these areas. And within Indian health services specifically, PMHNPs deliver culturally competent mental health care tailored to American Indian and Alaska Native populations. They integrate traditional healing practices with conventional mental health treatments, ensuring that care is respectful of and aligned with cultural values and practices. PMHNPs in this setting work to address mental health disparities, providing psychiatric evaluations, therapy, and substance abuse treatment, and support overall community well being with a focus on culturally sensitive care. Okay, only a couple left here. In the emergency department, PMHNPs provide urgent psychiatric assessments, crisis stabilization, and immediate intervention for mental health emergencies. They play a critical role in assessing patients presenting with acute issues such as suicidal ideation, severe anxiety, or even acute psychosis, ensuring that these individuals receive timely and appropriate care. PMHNPs coordinate with emergency medical staff to develop and implement safety plans, discharge planning, and referrals to appropriate follow up services. And then, last on our list here is a consult liaison. As part of consult liaison roles, PMHNPs integrate mental health expertise within general medical hospitals by providing psychiatric consultations to hospitalized patients. They assess and manage mental health conditions that may coexist with medical issues. They support medical staff with psychiatric care plans and help ensure holistic treatment approaches. This role specifically involves educating and guiding other healthcare providers, enhancing collaboration, and of course, delivering comprehensive care that addresses both physical and mental health needs. All right, everybody, that is all for this video, and I hope you learned a little bit about the various levels of care within the healthcare system and the importance of an integrated approach to delivering comprehensive care. I'll see you in the next one.